I'm Dr. Alan Moses. In my last video, I discussed how bilateral posterior stabilization achieves parallel arches, and in this video, I define Cant, C-A-N-T, and explain why X-Slant is the only bite registration system to use for capturing the static position of optimal oral airway dilation and stenting. Stenting is not a diagnosis, but rather a symptom or condition that relates to a specific etiology. Orofacial canting is easy for a dentist to recognize. It does not always need to be treated. An occlusal cant is defined as the vertical alteration in the upward or downward rotation of the occlusal plane in the frontal plane. Orofacial canting can be of neurological, muscular, skeletal, genetic, traumatic, or of neoplastic origin. Canting of the occlusal plane can originate in the maxilla or the mandible. Orofacial cant does require significant consideration in terms of interarch positioning in the bite registration for an oral sleep appliance. Orofacial canting is a complex, multidimensional condition. The oropharyngeal airway is a soft tissue tube, not in the mouth, but directly behind it, and unsupported in function by skeletal tissue. A bite registration device records a skeletal hard tissue maxillomandibular position that must be directly related to maximal orofacial soft tissue patency during sleep. Sleep dentistry has a dearth of literature about incorporating asymmetric jaw movement or canting into the multidimensional position. Zheng, in a study of patients with orofacial canting and mandibular deviation, reported significant differences in airway and asymmetric airway volume for different skeletal patterns. Moses, that's me, demonstrated that 95% of all human condyles are asymmetric relative to a sagittal plane. And the Moses study also demonstrated that anterior mandibular protrusion at the level of the maxillary incisors has an average asymmetry of 5 to 5.5 millimeters. Condylar movement rarely occurs in a straight midline linear plane. Intercondylar asymmetry and asymmetric jaw movement is the normal state in human beings. Bite registration devices that mechanically direct protrusive movement to a midline cranial plane do not have a sound scientific basis. The interrelationship between jaw positioning for maximal airway patency and stenting in patients with orofacial canting mandates that the sleep dentist must have a bite registration guide capable of factoring cant into the sleep appliance's positioning. Therefore, it must be bilateral and molar stabilized, and X-Slant is the only bilateral and molar stabilized bite registration guide available. It is patented and only available from Modern Dental Lab. Here's a very interesting case study. The main problem of this patient is obstructive sleep apnea, and his face clearly displays orofacial canting. He is compliant with CPAP and reports that it decreases his subjective daytime sleepiness. His sleep physician told him that CPAP was unable to get his AHI below 15 and to consider supplemental use of an oral sleep appliance to reduce his AHI to what he considered normal levels. The patient reported that he was only able to chew food on his right side. Practicing at a reasonable standard of care clearly mandates factoring the orofacial canting into the bite registration for fabricating an oral sleep appliance. Using bilateral molar stabilization, neuromuscular balance was achieved in a corrected vertical dimension, and the distance measured between the right posterior segment was 5.5 millimeters and 6.0 millimeters on the left, and his midlines coincide in the corrected bite. The only bite registration guide capable of physiologically accommodating cases of uneven vertical interarch height of the right and left sides is X-Slant. X-Slant has stackable shims of 1.5 or 2 millimeters vertical heights to appropriately compensate for the discrepancy created by vertical uneven bites. X-Slant is a patented bilateral molar stabilized bite registration guide providing proper dilation and stenting for stable support of the oropharyngeal airway because it integrates such essential attributes as establishing parallel dental arches, compensates for cant, eliminates slant, freely allow natural, lateral and protrusive asymmetric jaw movement, and compensate for unidimensional vertical interference factors, bilateral molar stabilization, stackable shims, and a wire cross-arch wire coupler, disposable, single patient use, effective for fabrication of any FDA-approved intraoral sleep appliance, and offering a choice of any of the bite registrations being digitally scannable or extruding bite registration paste between the arches.